So I'm Dr. Sharron Hinchliff. I'm a reader in psychology and health at the University of Sheffield, and I lead a programme of research that looks at the sexual rights and the sexual health and the sexual well-being of older adults.
How did you come by working on age and sexuality?
Oh gosh. So I started working this area. It's 20 years ago this year, actually. And it was the first researcher position that I got after my PhD. And that was working with Professor Merrin Gott, who I think she organised the first programme of research in the UK that was exploring sexual health, sexuality, and ageing. So a fantastic programme of research. The first project that we worked on was looking at quality of life and sexual health. It was across the adult life course, but we did have more people who were aged like 50 plus, and we found some really, really interesting information from that first project. And we interviewed older adults, and we also asked them to fill in a bit of a small questionnaire. And from that, it kind of grew because there were some issues around not getting the support that they needed within primary care, and we managed to get some funding to explore that in a bit more depth. And then we found that women were talking about menopause a lot and the impact that menopause could have on their sexual and intimate relationships. Luckily, we managed to get some funding to explore that as well. So I guess the program just grew and grew and grew. And it's still going now, although it's kind of diversified a little bit, and we have more of a sexual rights focus now. The sexual rights focus was always there, but I guess we didn't articulate it in that way, and now we do very clearly say that this is a sexual rights program of research.
I'm just thinking, am I going to start off with sexual rights? Because I know that you and Catherine Barrett have sort of reformulated and reframed the Declaration of Sexual Rights by the World Health Organization that specifically focuses on older adults. So why do you think that a reformulation or this reframing was necessary? And why should we actually look at later life sexuality nowadays? I mean, you know, there has been some time, as you've just said, it kind of grew from there. So is it still relevant to talk about it, and why?
Oh gosh, yes, I certainly think it is. Yeah, definitely still relevant. Both Catherine and I had been working in the field as researchers, but also I think Catherine had a nurse background as well, and working in the field for around 20 sort of years at the time when we got together to decide to write the book. And I guess it came out of a frustration because we kept hearing about sexual rights being breached. We were doing the research and working in, not me, I didn't work in clinical practice, but Catherine did, and hearing more and more about older adult sexual rights being breached. So, for example, I know that she did some work around older women who had been sexually abused and they'd not been believed. So they tried to report it, but then come across all sorts of barriers saying, you know, ageist barriers. So why would I believe you? You don't fit that kind of stereotype of what a victim of sexual assault looks like. So all sorts of issues around there. And just through interviewing lots and lots of older adults, I kept hearing this drip of the fact that their sexual rights were not being addressed, if you like, and they weren't being told really important information that could affect their sexual well-being. But yet I'd talked to GPs, and GPs were saying, oh, I always tell my younger patients that. And so we'd ask, well, do you mention that to your older patients? And they go, oh, no, I don't talk to my older patients about anything like that. So it was just that kind of revelation that, you know, something really, really does need to be done about that. I mean, we're hearing about it in Australia, we're hearing about it in the UK. I know it happens in other countries as well. So when we wrote the edited the sexual rights book collection, we decided to use the World Association for Sexual Health. We decided to use their framework, or if you like, their declaration of sexual rights, and just sort of make sure that all of the chapters and all of the content really did address that sexual rights declaration. And then our readers could take that and hopefully use that in their theoretical work. They could use it in their practical work. They could use it if they were writing any policies or designing any services. So we did actually write it with a very broad audience in mind.
Yeah, I remember the Norma report that dealt with sexual abuse
That's the
in
one.
retirement homes. And I read that when I started my PhD, and I was absolutely, I mean, it was on the one hand kind of fascinating, but also very much horrifying, because you rarely think about it that this happens in retirement homes, because you think there is some kind of safe space, you know, with medical experts and all of that. And you don't really think that there's sexual abuse or sort of infringements of sexual rights happening. And yeah. So I can get behind the sexual rights declaration for older adults, actually.
Yeah.
So was sexual rights something that you started off with when you started working on later life sexuality, or is it something that you sort of came to in the, you know, in the time span that you started working on it?
Yeah, I think the second option there is correct. I think the reason why sexual rights have never really been discussed in relation to older adults. They're quite new anyway, the concept of sexual rights, but they've been predominantly discussed and researched in relation to younger people, and that's in terms of preventing spread of unwanted, of any sort of sexually transmitted infections, or trying to prevent unwanted pregnancies. And that's been the predominant kind of focus of sexual rights. So we thought, well, wait a minute, they do apply across the life course. The World Association for Sexual Health say that. The World Health Organization is saying that, but nobody's actually recognizing that. And it's only a couple of years ago since we published the book, but there's a lot of people that still don't know that sexual rights do apply to older adults, and they do still associate sexual rights only with younger people. So I think we've got a lot of work to do getting that message across, that, you know, it is a life course perspective that we need.
If you know, it's the World Health Organization, you could think that even medical experts like GPs and so on, they know about that. What's your impression? Has that changed over the course of the last few years, that GPs become more open talking about STDs, for instance, or other sexual related or sexual health related problems or challenges that older adults face?
Mm-hmm. I think there's definitely more awareness in society. There's definitely more societal awareness and acceptance, if you like, of older adults' sort of sexual agency and sexual expression. I think there's still a lot of barriers within services and service provision. And a lot of them, when we do talk to practitioners, the barriers are around not knowing how to start conversations. And if they do start a conversation, not knowing what to do with it if something's disclosed. Is there any resource that I can refer this service user or this patient to help them get the support that they need? And because of that, they might think, well, it's like opening a can of worms, and therefore I'm not going to go there in the first place. If the services are not set up to support older adults, then it makes it really difficult for the practitioner to address those sexual rights of older adults. It creates another structural barrier.
If we look at, you know, general ideas towards later life sexuality, and I think there has been quite a bit of a change in the last, let's say, the last decade. I'm thinking of Joan Price, who has written on later life sexuality and has been publicly speaking about it and so on and so forth. I mean, not everyone might know her, but generally I think she's been rather popular in a certain field, so to speak.
Yes.
And there have, of course, been, I think Maren Gott also cites this article where I think it's the New York Times or the Sunday Times, and they call older adults the new teenagers, new rabbits, the only ones who are able to have recreational and string-free sexual intercourse, basically. So that sounds, of course, kind of positive. And you could probably think that this has sort of started to shift society's ideas about later life. Now, why are these positive imaginations or reimaginations, reframings of later life sexuality actually problematic?
We need to sort of acknowledge that they can be positive in that they're drawing awareness to that, and they're giving spaces for people like Joan Price to have that voice and have that visibility, which is fantastic, because it's something that we haven't seen, you know, within, I think she's been blogging for a few years now, but prior to that, like 20 years ago, we didn't see anything like that. So I think it's really positive in that respect. I think one of the difficult sides to it, or the problematic sides to it, that it can create that expectation that if we want to age well or age successfully, then we need to be sexually active. Because we get the narratives about, and I know some governments have actually released such narratives, the UK government for one, saying that if a few years ago, that if you are sexually active as an older person, then you're going to live longer than a non-sexually active older person, and you're going to look younger as well. So that's kind of coming from a source that really legitimates sexual activity in older life, which is fine. We do need that well, perhaps sometimes we do need someone to legitimize it, but it's giving the wrong message, because it's saying that, you know, if you're not being sexually active, then you're not looking after your health. And I think this can be exclusive. I mean, there are people that can't be sexually active because they haven't got a partner. They might have a disability. They might not want to be sexually active. So does that mean they're not looking after their health? Are they being irresponsible? So the concern is that that can create kind of shame and guilt within the older population if that becomes the dominant narrative that, you know, we need to be having sex if we want to be healthy and to age well.
To look younger.
And to look younger.
Do you think there's a middle way between this sort of either asexuality or not super sexual, but definitely continuously functional aspect?
There is, isn't there? And I mean, I think it's the same for anyone at any age. If you want to be sexually active and you're having consensual, pleasurable sex, then it does have kind of benefits for your health and well-being. But that's not to say that if we're not sexually active, we're going to become ill or we're going to die. And I know that in the 70s, there was something that was published really, really big in the gerontology fields, that's saying that if you're not sexually active as an older person, you get all sorts of ailments. You get diarrhea, you get wind, you get gallstones.
Okay.
Yeah. And I think this was the kind of start of that kind of narrative building, that you need to be sexually active to be aging well. Unfortunately, we get critical scholars like Merin Gort and Barbara Marshall that come along and say, no, this is obviously, there's not that much truth in that. It's just a way of sort of trying to promote sexual activity for a different agenda, usually.
The 70s seem to have been a very interesting time for later life sexuality. I just thought of David Reuben and his September Sex chapter, where he goes into what later life femininity means, and basically the moment estrogen is gone, you're not a real human being any longer, and it's just it's wild.
You become as close as you can to being a man.
Exactly.
He actually uses those words.
I mean,
and he finishes that up with the sort of the breasts go flat.
Exactly. You got exactly the body hair and the excess weight, and then she becomes as close to being a man. Oh, it's. I read that the first time and I thought, oh my, that must have been the 1930s or 20s, and then you see, no, it's the 70s. Okay, good.
And that book was one of the best sellers. It sold millions and millions of copies as well at the time, which is worrying.
What would your pieces of advice be to students that want to go into social gerontology, cultural gerontology, or later life sexuality?
Well, I guess it would be to read as widely as you can possibly read on the subject. There's some great authors. I don't want to start naming because I probably will forget someone and leave them out, and that will be completely unintentional, and I'd feel really, really bad about that. But I think always keep that critical gaze, you know, when you are reading something, because there's still research that's being published, which is, I think, is a little bit dodgy. People saying that, you know, it's usually aimed at women as well. You know, women, it's a bit like that archaic stuff about, you know, if you want to have a healthy baby, a woman's got to have an orgasm. You know, the stuff from 100 years ago. If the woman comes at the same time as the man, you know, at the same time, then that is a really healthy, perfect baby that you're going to have. All that kind of nonsense. We still get publications saying that, you know, if women have orgasms, they're in better health, they're more feminine and things like that. And I think it's really, really dangerous that stuff does actually get published in the first place. So I think it's keeping an eye on that and keeping a critical gaze and keeping it in the public profile as well, because it's taken such a long time to build like an awareness of older adults, sexual agency, and that sort of work, it's activism, it's come from all over the world, it's come from lots of different people, academics, clinicians, advocates, activists, older people themselves. And I think it's taken such a lot of work to get to this point that we need to keep it in the public consciousness if we want to make those positive changes where sexuality in older age is talked about. And when it is talked about, it's not seen as a taboo topic, so we can dispel any myths and misinformation that surround the topic, because there's a lot there as well.
Do you think there are still areas that sort of both gerontology and later life sexuality research has sort of neglected largely?
Oh gosh, yes, so many. I think we really need to see more research that's being done around LGBT sexuality and aging. That is a massive gap, especially qualitative research as well. We need research that actually engages meaningfully with older adults and can represent their experiences as well. And in transgender and aging as well, that's a big area where we need to see more research. When you look at the sexual wellbeing literature, it is predominantly heterosexual based, and it is predominantly research with white people. And they've been research conducted in the UK, in America, or in Australia. So we need to diversify out as well and include other communities within that research. But one of the things is that we need to do this unfunded, because sexuality, it's really difficult to get funding to do research on sexual health and sexual well-being and aging. It's not really a prioritised area. That's been my experience anyway, and it's like you have to fight really hard to get that funding.
It is still a taboo topic that I think a lot of people just feel really uncomfortable talking about it. Do you have any sort of final words or anything you want to add?
I think it would be the one about keeping this topic in the public consciousness, but trying to diversify what we know as much as possible. So we need to do that research with diverse communities, and we need to add that to the evidence base so that, you know, they can become part of our knowledge base about what happens to our sexuality as we get older, or how we experience our sexuality as we get older. So I mean sexuality as both a practice and also an identity. And there's not that much work that looks at the intersections between them both. And that is what I would encourage students to start doing now if they get the opportunities to do so.
Thank you very much for your time and that brief interview. That was fascinating talk, and I really liked just kind of talking to you about your work, because of course I've read quite a bit of it, and it's always nice to sort of see what you do with it and what you work with. So thank you very much for your time.
Oh, you're very welcome.